Question 1. In a healthcare disaster scenario, surge capacity refers to A. The ability of healthcare facilities to continue operating with limited resources. B. The amount of resources allocated to high-risk patients during a disaster. C. The capability of a healthcare system to expand its services to accommodate an influx of patients during a disaster. D. The provision of essential healthcare services during non-disaster periods. Answer C. The capability of a healthcare system to expand its services to accommodate an influx of patients during a disaster. Explanation. Surge capacity is a critical concept in disaster management, referring to the ability of the healthcare system to expand its operations and capacity to provide medical services in response to a sudden increase in demand during a disaster. This could involve activating additional medical personnel, using alternative phases, and mobilizing resources quickly. The correct answer, C, highlights this essential response capability. Option A is incorrect because it focuses only on limited resources, which is a part of surge capacity but doesn't fully explain it. Option B is incorrect since surge capacity doesn't refer solely to resource allocation to high-risk patients but encompasses the entire expansion of healthcare services. Option D is incorrect as surge capacity is specifically relevant during disasters, not routine healthcare service provision. Question 2. Scenario. Mr. Anderson is a disaster response coordinator tasked with overseeing a large healthcare facility during a mass casualty event. The facility has limited capacity and resources are being stretched. Then, in the triage area, he observes several patients in critical condition, some of whom will require immediate medical intervention, while others might survive with minimal attention. Mr. Anderson must prioritize which patients immediate care. Which triage category should Mr. Anderson assign the patients in the most urgent need of care? A. Green, minor injuries. B. Yellow, delayed care. C. Red, immediate care. D. Black, deceased. Answer C. Red, immediate care. Explanation. In disaster triage, patients are categorized based on the severity of their condition and their need for immediate medical attention. The red category refers to patients who require immediate care to survive, and these patients are prioritized for treatment. In this scenario, Mr. Anderson must ensure that the most critical patients, those who have life-threatening injuries but could survive with immediate care, are treated first. Option A is incorrect because the green category refers to patients with minor injuries who can wait for treatment without risk of worsening. Option B is incorrect as the yellow category refers to patients who need care but can tolerate delayed treatment without significant risk. Option D is incorrect as black is for patients who are deceased or have injuries so severe that they are unlikely to survive, and thus they are not prioritized for care. Question 3. During a disaster response, which of the following strategies is the most effective way to manage communication between various healthcare agencies and first responders in a large-scale disaster? A. Use of a single communication platform for all agencies, including social media and private networks. B. Establishment of a command center with a centralized communication system, such as the Incident Command System. C. Relying on local healthcare facilities to independently coordinate their own communication efforts. D. Having each agency independently manage its communication system without integration. Answer B. Establishment of a command center with a centralized communication system such as the Incident Command System. Explanation. The Incident Command System is a standardized on-scene or hazard incident management concept that facilitates coordination and communication between various responding agencies during a disaster. A centralized communication system ensures that all agencies involved in the response are effectively critical information in real time, which is vital to managing the disaster efficiently. Option A is incorrect because while social media can be useful for public information, a single platform alone isn't sufficient for managing communication between healthcare agencies and responders during a complex disaster scenario. Option C is incorrect because independent communication efforts can lead to confusion, duplication, and inefficiency in a large-scale disaster response. Option D is incorrect because lack of coordination between agencies is detrimental to disaster response effectiveness, which is why integrated communication systems are essential. Question 4. In a large-scale healthcare disaster response, coordination between healthcare facilities, public health agencies, and local governments is essential. What strategies should A disaster response coordinator implement to ensure efficient resource allocation and effective communication during such an event. Consider factors such as surge capacity, resource management, and interagency collaboration in your response. A. Assign a primary healthcare facility to manage all incoming patients and limit resource sharing to that facility. B. Implement a single source communication system that integrates real-time data from healthcare facilities, local governments, and public health agencies. C. Rely on each healthcare facility to manage its own resources without interagency collaboration to avoid redundancy. D. Prioritize communication with local hospitals only as they are the most experienced in disaster management and ignore smaller healthcare facilities. Answer: B. Implement a single source communication system that integrates real-time data from healthcare facilities, local governments, and public health agencies. Explanation: effective resource allocation and communication in disaster response require a coordinated effort across multiple entities, including healthcare facilities, public health agencies, and local governments. A single source communication system that provides real-time data allows better management of available resources and ensures that all agencies are on the same page regarding resource needs, available surge capacity, and patient care priorities. Option A is incorrect as assigning a single healthcare facility to manage all patients would strain resources and hinder the coordinated response required for large-scale disasters. Option C is incorrect because in a disaster, collaboration between agencies is critical for efficient resource management. An independent operation can lead to inefficiencies and confusion. Option D is incorrect because disaster responses a collective effort, and ignoring smaller healthcare facilities can lead to underutilization of resources and a lack of support where it is most needed. Question 5. Scenario: Dr. Evans is part of a disaster medical team (DMT) that has been deployed to a remote area following a large earthquake. The team must quickly set up a field hospital to address injuries, prioritize care, and treat the most critically injured patients. Given the limited resources, Dr. Evans must manage the medical triage process to ensure that care is delivered efficiently. Which of the following approaches best with the principles of triage in disaster settings? A. Provide immediate care to the patients with the most severe injuries, regardless of their likelihood of survival, and disregard less severe cases. B. Prioritize care based on the severity of injuries, with immediate treatment for those most likely to survive if treated promptly, and delay treatment for patients with minor injuries. C. Treat all patients equally, providing the same level of care to everyone regardless of injury severity. Focus solely on the most critical patients and leave less critical patients to fend for themselves as resources are limited. Answer: B. Prioritize care based on the severity of injuries, with immediate treatment for those most likely to survive if treated promptly, and delay treatment for patients with minor injuries. Explanation: triage in disaster settings prioritizes the treatment of patients based on the severity of their injuries and their chances of survival if treated promptly. The goal is to maximize the number of survivors by allocating resources efficiently. In this, Dr. Evans should focus on those patients who have life-threatening injuries but are likely to survive if treated quickly, while delaying care for patients with less severe injuries. Option A is incorrect because treating patients solely based on the severity of injuries without considering survival potential would waste resources on patients who are unlikely to survive despite treatment. Option C is incorrect because equal treatment of all patients without considering the severity of their injuries or likelihood of survival would be inefficient and result in the loss of more lives. Option D is incorrect because ignoring less critical patients entirely is unethical and inconsistent with triage principles, which prioritize care for the greatest number of survivors. Question 6. Which of the following is the most effective method for managing healthcare resources and supplies during the recovery phase of a disaster, considering both immediate and long-term needs? A. Use emergency reserves for immediate relief and then shift focus to long-term recovery efforts without considering ongoing resource needs. B. Rely on spontaneous donations from non-coordinated sources to meet immediate needs and shift focus to international aid for long-term recovery. C. Establish a coordinated system of resource allocation that considers both short-term emergency needs and long-term recovery goals in continued supply chain management. D. Distribute resources equally to all affected areas, regardless of severity, and reassess needs only after immediate relief efforts are complete. Answer C. Establish a coordinated system of resource allocation that considers both short-term emergency needs and long-term recovery goals, ensuring continued supply chain management. Explanation: effective management of healthcare resources during the recovery phase requires a strategic approach that balances immediate relief efforts with long-term recovery goals. A coordinated system of resource allocation ensures that both immediate needs are while maintaining a steady supply of resources for ongoing recovery efforts. Proper supply chain management is essential to avoid resource shortages as the situation evolves. Option A is incorrect because relying solely on emergency reserves without ongoing resource management can lead to shortages as recovery progresses. Option B is incorrect because uncoordinated donations can create logistical challenges and waste resources, hindering the effectiveness of the response. Option D is incorrect because an equal distribution of resources without considering severity can lead to inefficiencies and failure to prioritize areas with the greatest need. Question 7. Which of the following strategies is most critical for maintaining healthcare facility operations during the preparedness phase of disaster management? A. Conducting annual disaster drills to familiarize staff with emergency protocols, ensuring efficient coordination during an actual disaster. B. Installing backup generators without testing them to assume that they will function during a disaster. C. Ensuring that each department in the healthcare facility operates independently without coordination with other departments during a disaster. D. Maintaining a static, one-size-fits-all disaster plan does not account for variations in disaster scenarios. Answer: A. Conducting annual disaster drills to familiarize staff with emergency protocols, ensuring efficient coordination during an actual disaster. Explanation: preparedness is a key phase in disaster management, and regular training and simulation exercises are essential for ensuring that healthcare facility staff are familiar with emergency protocols. Annual disaster drills help to identify gaps in the system, test the effectiveness of response strategies, and ensure that all staff are well prepared to work efficiently in a high-stress environment. Option B is incorrect because installing backup generators without testing them can lead to failure during a real disaster, undermining the healthcare facility's ability to maintain operations. Option C is incorrect as coordination between departments is essential during disaster to ensure efficient resource use and patient care. Independent operation can result in confusion and inefficiency. Option D is incorrect because flexible disaster plan is necessary to adapt to different scenarios, and static plan does not account for the dynamic nature of disaster events. Question 8. In healthcare disaster response, a comprehensive hazard vulnerability analysis (HVA) is essential for identifying risks and preparing for potential emergencies. Which of the following actions is most effective in conducting an HVA for a healthcare facility? A. Rely solely on historical disaster data to determine potential hazards, ignoring new or emerging threats. B. Engage a diverse group of stakeholders, including healthcare staff, public health officials, and local emergency responders, to assess all possible hazards and vulnerabilities. C. Conduct the HVA at a one-time exercise and avoid revisiting it until the next disaster occurs. D. Focus only on external hazards, such as earth and hurricanes, and disregard internal risks like power failures or disease outbreaks. Answer: B. Engage a diverse group of stakeholders, including healthcare staff, public health officials, and local emergency responders, to assess all possible hazards and vulnerabilities. Explanation: a comprehensive HVA involves a collaborative approach that incorporates input from various stakeholders to identify and assess both internal and external risks. This allows for a well-rounded understanding of the potential hazards that could affect the health facility, ensuring that the disaster plan is robust and covers all potential threats. Option A is incorrect because relying solely on historical data can leave healthcare facilities unprepared for emerging threats, such as pandemics or new types of disasters. Option C is incorrect because HVAS should be reviewed and updated regularly to reflect changes in risks, infrastructure, and community needs. Option D is incorrect as focusing only on external hazards leaves the healthcare facility vulnerable to internal risks, such as power outages or equipment failures, which can be just as damaging during a disaster. Question 9. In a disaster response scenario, the role of the incident command system ICE is to A. Coordinate communication between healthcare facilities only and exclude public health agencies from the process. B. Oversee all disaster response efforts, ensuring coordinated action across multiple agencies and sectors. C. Focus exclusively on emergency medical care, leaving other aspects of disaster management to separate teams. Allow individual healthcare facilities to operate independently without oversight to avoid delays in decision-making. Answer: B. Oversee all disaster response efforts and ensuring coordinated action across multiple agencies and sectors. Explanation: the Incident Command System ICE is a structured framework used to manage disaster response efforts. ICE ensures that all agencies involved in the response, healthcare, public health, emergency services, and others, coordinate their activities effectively. This centralized command helps streamline decision-making, optimize resource allocation, and ensure unified approach. Option A is incorrect because ICE involves all relevant agencies, not just healthcare facilities. Excluding public health agencies would compromise the overall response. Option C is incorrect because ICE is broader in scope and involves much more than emergency medical care. It coordinates all aspects of disaster management. Option D is incorrect because decentralized response without coordination leads to inefficiency and confusion, especially in large-scale disasters. Question 10. In the event of a large-scale disaster, a healthcare facility faces an overwhelming number of casualties requiring triage and treatment. Which of the following is the most effective approach to ensure optimal patient care and resource allocation while minimizing healthcare worker burnout? A. Allocate the majority of resources to patients with the most severe injuries and assign fewer resources to those with less critical injuries, regardless of their ability to recover. B. Implement a rotating shift system for healthcare workers to ensure they are well rested and can work effectively while maintaining clear communication about patient prioritization. C. Focus exclusively on those with minor injuries to avoid overloading healthcare workers. Severe cases leaving critical patients untreated. D. Distribute resources equally among all patients, regardless of severity, to ensure that no individual feels neglected. Answer: B. Implement a rotating shift system for healthcare workers to ensure they are well rested and can work effectively while maintaining clear communication about patient prioritization. Explanation: the rotating shift system is essential in preventing healthcare worker burnout and ensuring that they can continue to provide care over an extended period. Additionally, clear communication about patient prioritization ensures that the most critical receive the care they need while not overburdening any single team. Option A is incorrect as it fails to consider the importance of balancing resources based on patient recovery potential. Option C is incorrect because focusing only on minor injuries is inadequate during a large-scale disaster where severe cases require immediate attention. Option D is incorrect because distributing resources equally without considering patient severity would be inefficient and potentially wasteful, reducing the chances of successful outcomes for those with critical needs. Question 11. During the preparedness phase of disaster management, a healthcare facility is required to develop a continuity of operations plan. COOP. What is the primary purpose of a COOP in this context? A. To outline the procedures for the evacuation of all patients and healthcare workers in case of a disaster. B. To ensure the continued provision of essential services such as emergency care even when key staff or infrastructure are unavailable due to the disaster. C. To document the history of disasters in the region and provide a reference for future planning. D. To create a communication strategy solely for the public, leaving it communication to be handled informally. Answer: B. To ensure the continued provision of essential services such as emergency care even when key staff or infrastructure are unavailable due to the disaster. Explanation: a COOP ensures that essential healthcare services can continue during and after a disaster even if some infrastructure or key personnel are unavailable. This includes identifying critical functions that must be maintained and the strategies to support them. Option A is incorrect because an evacuation plan is not the primary focus of a COOP, it's more about continuity of services. Option C is incorrect because documenting historical data is helpful, but it does not directly relate to the primary goal of ensuring operational continuity during a disaster. Option D is incorrect as communication within the organization is just as crucial as public communication in ensuring effective disaster response. Question 12. Which of the following best describes the concept of medical surge capacity in the context of disaster response, and why is it crucial for healthcare facilities? A. The ability to treat a large number of patients without the need for additional medical personnel or equipment. B. The capacity to increase the volume of patients treated in a short period through temporary expansion of healthcare resources, including staff, facilities, and equipment. C. The ability to maintain patient care in a hospital's normal operating conditions without any adjustments to staffing or resources. D. The process of reducing the number of incoming patients by limiting treatment to those with the most critical injuries. Answer. B. The capacity to increase the volume of patients treated in a short period through temporary expansion of healthcare resources, including staff, facilities, and equipment. Explanation. Medical surge capacity refers to the ability of a healthcare facility to rapidly increase its capacity to treat a large influx of patients during a disaster. This may involve expanding facilities, increasing the number of staff, or acquiring additional medical supplies. Option A is incorrect because medical surge capacity is about increasing the ability to treat more patients rather than maintaining normal operations without adjustments. Option C is incorrect because surge capacity requires adjusting normal operations to accommodate the increased demand. Option D is incorrect because surge capacity focuses on treating as many patients as possible, not limiting care. Question 13. In the recovery phase of disaster management, healthcare facilities must work to re-establish normal operations. What is the most critical factor in ensuring a smooth transition from disaster response to recovery? A. Ensuring that all financial records and claims are processed before addressing any physical damage to the facility. B. Focusing primarily on repairing physical infrastructure and deferring patient care services until the facility is fully operational. C. Prioritizing the resumption of patient care and healthcare services while also addressing physical and operational recovery in parallel. D. Waiting until all healthcare workers are available to return work before making any decisions about resuming services. Answer. C. Prioritizing the resumption of patient care and healthcare services while also addressing physical and operational recovery in parallel. Explanation. The recovery phase should prioritize resuming essential patient care as soon as possible while also addressing physical infrastructure and operational recovery. This dual approach helps ensure that healthcare services are not unnecessarily delayed while the facility is restored to full operational state. Option A is incorrect because financial recovery should follow the resumption of healthcare services. Patient care should not be delayed for administrative purposes. Option B is incorrect because patient care services are the top priority in the recovery phase, and delaying this can worsen the effects of the disaster. Option D is incorrect because waiting for all healthcare workers to return could unnecessarily delay the recovery process. Question 14. A hospital is preparing for an upcoming major natural disaster, and the leadership team needs to develop a communication plan to manage both internal and external communications. Which of the following is the most important aspect of such a plan? A. Ensuring that internal communication only involves department heads to avoid confusion. B. Developing a centralized communication system that allows for real-time information sharing between all departments, healthcare workers, and external agencies. C. Using social media platforms as the sole communication tool to reach patients and the public. D. Limiting external communication to government agencies and excluding the media, the public. Answer. B. Developing a centralized communication system that allows for real-time information sharing between all departments, healthcare workers, and external agencies. Explanation. A centralized communication system is essential for ensuring that all stakeholders, including healthcare workers, departments, and external agencies, are kept informed and can make timely, coordinated decisions during a disaster. Option A is incorrect because communication should include all staff members and stakeholders to avoid gaps in information and ensure everyone is informed. Option C is incorrect as relying solely on social media could lead to miscommunication and doesn't reach all stakeholders effectively. Option D is incorrect because external communication should include both government agencies and the public, especially to provide updates and accurate information. Question 15. Which of the following strategies is most effective in ensuring that healthcare workers remain psychologically resilient during a prolonged disaster response? A. Providing periodic mental health support and counseling to healthcare workers while fostering a culture of openness about mental health challenges. B. Asking healthcare workers to work continuously for extended shifts without breaks to maintain momentum and productivity. C. Discouraging discussions about stress and mental health concerns to avoid disrupting the team's focus on patient care. D. Providing minimal training in stress management to avoid diverting resources from immediate patient care. Answer A. Providing periodic mental health support and counseling to healthcare workers while fostering a culture of openness about mental health challenges. Explanation. Healthcare workers' psychological resilience can be supported through periodic mental health counseling and fostering an environment where stress and mental health challenges can be openly discussed. This approach helps prevent burnout and ensures workers maintain their ability to provide high-quality care over an extended period. Option B is incorrect because extended shifts without breaks can lead to burnout, fatigue, and decreased job performance. Option C is incorrect because ignoring stress and mental health concerns can lead to higher rates of burnout and decreased worker efficacy. Option D is incorrect because training in stress management is essential for maintaining healthcare workers' mental health during prolonged disaster response. Question 16. What is the primary purpose of conducting a post-disaster after-action review in healthcare disaster management, and what should it focus on? A. To assess the number of patients treated and the resources consumed, with a focus on future cost-saving measures. B. To evaluate the effectiveness of the disaster response, identify gaps in the system, and make recommendations for future improvements. C. To focus on public relations and media coverage, ensuring that the healthcare facility's reputation is maintained. D. To review the financial cost of the disaster response and prepare a budget reimbursement claims. Answer B. To evaluate the effectiveness of the disaster response, identify gaps in the system, and make recommendations for future improvements. Explanation. The primary purpose of an R is to assess how the disaster response was managed, identify areas of strength and weakness, and provide recommendations for future improvements in disaster preparedness and response. Option A is incorrect because an R should focus on evaluating response effectiveness rather than just financial aspects. Option C is incorrect as the focus should be on improving response procedures, not public relations. Option D is incorrect as the financial aspects are secondary to evaluating the overall effectiveness and making necessary adjustments for future responses. Question 17. During a public health emergency, a healthcare facility faces a shortage of critical medical supplies. Which of the following strategies is most effective in managing the shortage while maintaining patient care standards? A. Ration supplies based on the severity of the situation, prioritizing the most critical patients and reusing supplies wherever possible. B. Immediately request additional supplies from international sources without assessing local needs or available resources. C. Continue providing the same level of care regardless of the shortage without altering treatment protocols. D. Suspend patient care altogether until the required supplies are received. Answer A. Ration supplies based on the severity of the situation, prioritizing the most critical patients and reusing supplies wherever possible. Explanation. Rationing supplies effectively during a shortage involves prioritizing the most critically ill patients and making strategic decisions about resource use, such as reusing supplies or using them in the most effective way. Option B is incorrect as requesting additional supplies without assessing local resources could lead to delays and mismanagement of available resources. Option C is incorrect because maintaining the same level of care without adjustments would exacerbate the shortage and could compromise patient safety. Option D is incorrect as suspending care is an extreme and unnecessary step that would harm patients. Question 18. A hospital is faced with an influx of patients after a large-scale disaster and there is concern about a shortage of both personnel and medical supplies. Which of the following actions should be prioritized to maintain the most effective care and mitigate risks to patients and staff? A. Redirect all available resources towards treating the most severely injured patients and allow those with less critical needs to wait. B. Implement a triage system that prioritizes patients based on the severity of their injuries, while allocating resources to ensure that all patients receive at least basic care. C. Focus only on providing treatment to patients who require long-term care, as they are most likely to benefit from intervention. D. Limit the number of patients admitted to a facility and encourage patients to seek care elsewhere. Answer B. Implement a triage system that prioritizes patients based on the severity of their injuries while allocating resources to ensure that all patients receive at least basic care. Explanation: the triage system helps prioritize patients based on the severity of their injuries, ensuring that resources are allocated where they can do the most good. This approach ensures that critical patients are treated first, but no one is left without care. Option A is incorrect because it neglects patients with less severe injuries, leaving them at risk of worsening conditions. Option C is incorrect because focusing only on long-term care patients neglects the immediate needs of those with acute injuries. Option D is incorrect as limiting patient intake could leave some patients without necessary care during an emergency. Question 19. In the event of a disaster, a healthcare facility must maintain communication with multiple stakeholders, including emergency responders, government agencies, and patients. Which communication strategy is most effective in ensuring timely and accurate information dissemination? A. Relying solely on email for internal communication to avoid overwhelming the system. B. Setting up a dedicated emergency communication system that includes phone trees, radio, and online platforms to ensure redundancy and availability. C. Allowing each department to manage communication independently as long as they follow the general guidelines. D. Relying on social media platforms for both internal and external communication to ensure the public is informed. Answer: B. Setting up a dedicated emergency communication system that includes phone trees, radio, and online platforms to ensure redundancy and availability. Explanation: a dedicated, multi-channel communication system ensures that messages can be reliably delivered through various means, reducing the risk of communication failure in the event of system overloads or infrastructure damage. Option A is incorrect because email alone is not reliable enough, especially during emergencies when systems may be down. Option C is incorrect because decentralized communication could lead to inconsistent messages or failures in coordination. Option D is incorrect because social media is not a reliable method for internal communication during a disaster and may not be suitable for sharing sensitive information. Question 20. A healthcare facility is experiencing an overwhelming number of patients during a disaster. What should be the primary focus of the hospital's incident command team to ensure effective and efficient management of patient care? A. Focus on treating as many patients as possible regardless of their condition to prevent any patient from feeling neglected. B. Implement rapid assessment system to categorize patients based on the urgency of care needed and allocate resources accordingly. C. Allocate all available resources to critical patients and disregard the care of less critical patients. D. Focus primarily on restoring infrastructure and equipment before patient care needs. Answer: B. Implement a rapid assessment system to categorize patients based on the urgency of care needed and allocate resources accordingly. Explanation: a rapid assessment system such as triage ensures that the most critical patients receive immediate care while resources are allocated efficiently. This system helps ensure that care is prioritized based on patient needs. Option A is incorrect because treating all patients equally without considering urgency can lead to inadequate care for those who need it most. Option C is incorrect because neglecting less critical patients could result in unnecessary suffering and potentially worsened outcomes. Option D is incorrect because patient care should always take precedence and infrastructure restoration should be managed in parallel. Question 21. After disaster, a healthcare facility must manage the increased demand for medical care while maintaining its operations. Which of the following strategies would most effectively support healthcare workers and prevent burnout during a prolonged disaster response? A. Allow healthcare workers to work continuous 12-hour shifts without breaks as long as they take occasional rest periods between shifts. B. Implement a rotating shift system that ensures healthcare workers have adequate rest while maintaining patient care capacity. C. Discourage healthcare workers from discussing their stress and emotional challenges to avoid disrupting the team's morale. D. Minimize the number of healthcare workers on duty to reduce the risk resource depletion. Answer: B. Implement a rotating shift system that ensures healthcare workers have adequate rest while maintaining patient care capacity. Explanation: a rotating shift system ensures that healthcare workers are well rested and not overwhelmed. which is critical in maintaining their effectiveness during a prolonged response. This approach also prevents burnout and preserves overall patient care quality. Option A is incorrect because long shifts without adequate breaks lead to physical and mental exhaustion, ultimately reducing the quality of care. Option C is incorrect as ignoring stress and emotional challenges can result in burnout and low morale. Option D is incorrect because reducing the number of healthcare workers could further strain the system and worsen care outcomes. Question 22. During a disaster, a healthcare facility experiences a shortage of critical medication. Which of the following strategies is most appropriate for managing this shortage while maintaining patient safety? A. Ration medication based on the severity of the patient's conditions, ensuring that the most critical patients receive the necessary doses. B. Encourage patients to go to other facilities for medication, if possible, without providing guidance on how to obtain it. C. Distribute medications equally among all patients to avoid accusations of favoritism. D. Discontinue all non-essential treatments and reserve medications solely for those life-threatening conditions. Answer. A. Ration medication based on the severity of the patient's conditions, ensuring that the most critical patients receive the necessary doses. Explanation. Rationing medications based on patient severity ensures that critical patients receive the treatment they need first, while still providing some level of care to other patients. This strategy maximizes the benefit of limited resources. Option B is incorrect because sending patients to other facilities without proper guidance may lead to confusion or delays in care. Option C is incorrect because distributing medications equally without considering patient needs can result in ineffective care and harm to those most in need. Option D is incorrect because discontinuing non-essential treatments without assessing the broader impact on patient care can lead to unnecessary complications. Question 23. After a major disaster, a healthcare facility must ensure continuity of care despite potential interruptions to its regular operations. Which of the following actions would best help the facility maintain essential services? A. Focus primarily on restoring elective and non-urgent care services as soon as possible. B. Assess critical functions that must be maintained, such as emergency care and vital services, and develop a plan to continue those functions even if other services are interrupted. C. Suspend all non-essential services and wait for external assistance before resuming operations. D. Allocate resources solely for infrastructure repaired patient care until the facility is fully operational again. Answer. B. Assess critical functions that must be maintained, such as emergency care and vital services, and develop a plan to continue those functions even if other services are interrupted. Explanation. Identifying and maintaining critical functions such as emergency care and vital services is essential to ensure that patients receive the necessary care during a disaster. This approach ensures that core services are not interrupted while the facility recovers. Option A is incorrect because focusing on elective and non-urgent care would divert resources from critical services needed immediately. Option C is incorrect because suspending services entirely can exacerbate the situation and lead to unnecessary patient harm. Option D is incorrect as infrastructure repair alone should not delay patient care, which should remain the top priority. Question 24. A healthcare facility is preparing for an influx of patients during a public health emergency. What is the most important factor in determining the level of care that patients should receive during this period? A. The number of patients present at the facility, with care being given based on the quantity rather than the severity of the cases. B. The resources available, including staff, medical supplies, and equipment, and prioritizing care for patients who have the highest chance of survival. C. The specific medical needs of each patient, treating those with chronic conditions first to prevent deterioration. D. The geographical location of patients, prioritize those who are closest to the healthcare facility. Answer. B. The resources available, including staff, medical supplies, and equipment, and prioritizing care for patients who have the highest chance of survival. Explanation. During a public health emergency, prioritizing care based on available resources ensures that those with the highest chances of survival receive the care they need. This approach minimizes unnecessary deaths and maximizes the overall benefit of available resources. Option A is incorrect because the number of patients alone should not determine care levels. The severity and survival potential are key. Option C is incorrect because chronic conditions, while important, may not be as time-sensitive during a public health emergency compared to more acute conditions. Option D is incorrect, as proximity should not be a determining factor in care allocation during emergencies. Question 25. A healthcare facility is planning its disaster response strategy. Which of the following best describes the role of training and simulation exercises in disaster preparedness? A. Training exercises are only necessary for leadership teams, as they are the decision makers during a disaster. B. Training and simulation exercises allow healthcare workers to practice emergency protocols and assess the effectiveness of their response in real-world scenarios, ensuring a faster, coordinated response during actual events. C. Simulation exercises are used primarily to assess the facility's infrastructure rather than focusing staff readiness or emergency response. D. Training exercises should be limited to theoretical scenarios, as real-life exercises can disrupt normal operations. Answer: B. Training and simulation exercises allow healthcare workers to practice emergency protocols and assess the effectiveness of their response in real-world scenarios, ensuring a faster, coordinated response during actual events. Explanation: Simulation exercises allow healthcare workers to familiarize themselves with disaster protocols and improve coordination under pressure. This helps them react more effectively in actual emergencies, ensuring a well-coordinated response. Option A is incorrect, because all staff members should be trained, not just leadership, as disaster response involves everyone. Option C is incorrect, because staff readiness is a key focus of simulations, not just infrastructure. Option D is incorrect, because real-life exercises provide essential experience that helps teams respond effectively when faced with actual disasters. Question 26. During a disaster response, a healthcare facility must manage an increased number of patients with limited resources. Which of the following strategies should be employed to ensure the most efficient use of medical resources while providing care to all patients? A. Treat patients based on their ability to pay for care, ensuring those with financial means receive priority treatment. B. Focus all available resources on critically ill patients, leaving less urgent cases untreated. C. Implement a triage system that prioritizes care based on the severity of patients' conditions, ensuring those who need immediate care are treated first. D. Limit the number of patients treated to avoid resource turning away patients when the facility reaches capacity. Answer: C. Implement a triage system that prioritizes care based on the severity of patients' conditions, ensuring those who need immediate care are treated first. Explanation: a triage system helps allocate resources based on urgency, ensuring that the most critical patients receive immediate care while less severe cases can wait. This strategy is the most effective in managing limited resources during a disaster. Option A is incorrect, because healthcare should be based on need, not financial capacity, especially during a disaster. Option B is incorrect, because while critically ill patients should be prioritized, leaving others untreated can lead to preventable complications or deaths. Option D is incorrect, because turning away patients without assessing needs could lead to unnecessary harm or preventable deaths. Question 27. A healthcare facility is experiencing a surge in patients following a disaster, and there is a shortage of both staff and medical supplies. What is the most effective strategy for maintaining patient care during this critical period? A. Reduce the number of medical personnel to cut costs and avoid overwhelming the system. B. Delegate non-medical tasks to volunteers or support staff, allowing healthcare professionals to focus on patient care. C. Focus solely on the most severe cases and ignore those with less critical needs, as they may not survive the initial crisis. D. Immediately transfer all patients to neighboring healthcare facilities without assessing the level of care required. Answer: B. Delegate non-medical tasks to volunteers or support staff, allowing healthcare professionals to focus on patient care. Explanation: Delegating non-medical tasks to support staff or volunteers ensures that healthcare professionals can focus on providing critical care to patients. This helps maximize the capacity of the facility to treat more patients effectively. Option A is incorrect, because reducing staff may worsen the situation and lead to further strain on remaining personnel. Option C is incorrect, because neglecting less critical patients could result in preventable suffering or worse outcomes. Option D is incorrect, because transferring patients without assessment could lead to further complications and potentially overwhelm other facilities. Question 28. A healthcare facility must prepare for the possibility of a prolonged disaster. What is the most important factor to consider when creating an emergency response plan to ensure continued care throughout the event? A. Focusing on the rapid restoration of elective surgeries and non-emergency care services. B. Ensuring there is a sufficient stockpile of essential medications, medical supplies, and equipment to maintain operations for an extended period. C. Creating a strict policy that limits patient intake to avoid overwhelming the facility. D. Relying on external agencies and organizations to provide necessary resources throughout the event with eternal preparation. Answer: B. Ensuring there is a sufficient stockpile of essential medications, medical supplies, and equipment to maintain operations for an extended period. Explanation: a sufficient stockpile of medical supplies and medications is crucial for ensuring that the healthcare facility can continue to provide care throughout a prolonged disaster. This strategy helps ensure that basic needs can be met without relying entirely on external resources, which may not be immediately available. Option A is incorrect because focusing on elective care during a disaster diverts resources from more urgent needs. Option C is incorrect because limiting patient intake could leave many people without care during an emergency. Option D is incorrect as over-reliance on external agencies could lead to gaps in care during critical times. Question 29. A healthcare facility is preparing for a public health emergency and needs to develop a strategy for managing a surge in both critically ill and mildly ill patients. Which of the following is the best approach to ensure the facility can handle this influx effectively? A. Prepare to admit all patients immediately without assessment to avoid delays in care. B. Implement a flexible staffing and triage system that can be adjusted based on the severity of patients' needs and available resources. C. Prioritize long-term care patients and postpone the treatment of emergency cases to ensure long-term care patients remain stable. D. Focus only on patients with life-threatening conditions and send other patients without treatment. Answer: B. Implement a flexible staffing and triage system that can be adjusted based on the severity of patients' needs and available resources. Explanation: a flexible staffing and triage system allows the facility to adjust its approach based on patient needs and available resources, ensuring that critical patients receive immediate care while less urgent cases can be handled as resources allow. Option A is incorrect because admitting all patients immediately without assessing their needs could overwhelm the system and lead to resource depletion. Option C is incorrect because prioritizing long-term care patients over emergency cases could result in worsened outcomes for those in immediate need of care. Option D is incorrect because sending home non-critical patients without assessment could result in preventable complications and delays in treatment for those who require it. Question 30. After disaster, a healthcare facility needs to ensure its staff remains effective and healthy throughout the crisis. What is the most effective way to maintain staff well-being during a prolonged disaster response? A. Encourage staff to work long shifts to ensure all necessary tasks are completed. B. Provide adequate breaks, support for mental health, and adequate sleep to prevent burnout and fatigue. C. Restrict staff from taking any time off during the disaster to maintain maximum manpower. D. Discourage staff from expressing concerns or emotions to avoid distractions during the crisis. Answer: B. Provide adequate breaks, support for mental health, and adequate sleep to prevent burnout and fatigue. Explanation: supporting staff well-being is critical to maintaining their effectiveness throughout a disaster response. Adequate breaks, sleep, and mental health support help prevent burnout, improve decision-making, and ensure sustained performance. Option A is incorrect because long shifts without adequate rest lead to exhaustion, errors, and poor patient care. Option C is incorrect because not allowing time off would lead to physical and mental fatigue, decreasing staff performance. Option D is incorrect because discouraging emotional expression can harm staff mental health and undermine team morale.